Tell me when you're rolling.
That's it. There we go. We're rolling.
Hey everybody, it's Dr. G, and today I'm going to show you how to identify a pinched nerve on the x-ray. So the first thing, before prompting an x-ray, you want to make sure that the patient is showing signs and symptoms of a pinched nerve, and then you get the x-ray to confirm. So go ahead and come on in. And what I want, obviously we can see this is a neck, this is the front of the face, the back of the head. What I want you to pay attention to is the discs here. So this model will show you the disc. It's essentially a sac of fluid that protects the nerve. It keeps the joint open. On a normal disc, you want to see it open in the front on an x-ray, open in the back, and you can't see the nerve, but if we can see the disc, we can see basically where that nerve is housed, right? So if I show you here, if we zoom in, I can probably do this with my left hand, right? So this is the disc. It's open in the front, open in the back, so it's nice and healthy. So you want to see that, but you also want to see more or less that all the discs are about the same size. And I mean, it's fairly obvious. If I start coming down here, you can see that one's smaller. I can zoom in and I can compare the heights of the disc, and we can clearly see that this disc is a lot smaller than the surrounding discs. So what that tells you is that if we should have a full healthy disc supporting the nerve, and that nerve space is smaller because the disc is starting to decay and it's lost fluid, then you're more likely to have a pinched nerve in that area. So correlating that with the symptoms, and obviously that tells us there's a pinched nerve in that area. I got another cool one that most doctors don't understand, and then so any of you doctors or chiropractors or whoever's out there, this one might be a cool one for you to look at too and understand. So if you do a motion x-ray, instead of just the lateral x-ray, if you do a motion x-ray when the patient bends their head forward, what you actually should see is one bone should slightly slide in front of the other, right? So as we travel down, look at that one. That's where that disc was smaller. It's not moving in front when the patient's bending their head forward. So you've lost movement in this joint. So that's called subluxation. Subluxation is when you get loss of movement within a joint, and over time it is going to deteriorate and damage that disc. So most doctors, when they see degenerative disc disease on an x-ray, or they see or they can identify a pinched nerve, they're going to say do injections, do medication, something like. And then what that does, it calms the nerve inflammation. But the point of this is to show you that just because you get the inflammation down, that's not going to fix that joint. The only way to fix that joint and to actually help prevent it from getting worse is if you restore proper movement in that joint. So this is extremely important for chiropractors to understand, that joint movement, because if you can identify that, then you can have a treatment plan to help correct it, and long term you're going to really benefit your patient's health. That's probably way too long.